Doing really well here, Neil. And you?
Fantastic. In today's topic, colon cancer in women. Is colon cancer in women easy to diagnose?
Absolutely not. It's very difficult to diagnose early. That's the problem.
Why is it difficult to diagnose colon cancer early?
Well, there are many symptoms and that are vague and could be, bloating. It could be easy, filling up. Can't eat very much. Could also come along or present as irritable bowel, constipation, reflux, diverticulosis, diverticulitis. So there are a whole bunch of things that have similar symptoms that aren't cancer and aren't dangerous.
What are later symptoms of colon cancer?
Well, of course, they would be nausea, vomiting, black tarry stools, loss of appetite, feeling full, mass in the abdomen, enlarging waistline, and of course, rectal bleeding, blood in the stool, weight loss, fatigue, and weakness. All of those symptoms are possible when you get to have advanced cancer.
What are the five stages of colon cancer?
Well, the first stage is zero, and that's just confined to the lining. It has an excellent 5-year survival, 95%. And then there's stage one, which is colon wall, and then stage two, which is through the colon wall. Stage three is lymph nodes that are close, and stage four is distant mets like liver, lung, backbone.
Is colon cancer hereditary?
Well, yes, in about 10 to 15% of people, it is hereditary. You can have various syndromes, Lynch, familial adenomatous polyposis, and those are just a couple examples of what are hereditary colon cancers.
What is the primary treatment for colon cancer?
Well, it has been and probably will remain surgery, but so chemo has a place. There are a lot of times if you have a big tumor, a bulky tumor that's like a stage three or four, then sometimes they give chemo first to shrink the tumor to make it easier to do surgery on, and then radiation later on.
Is there a difference between left-sided and right-sided colon cancer?
Well, yes, in a nutshell, right-sided colon cancer is more common in women, and it also presents later because the symptoms are different. Now, when you have left-sided colon cancer, one of the first symptoms you have is difficulty with bowel movements, and then, of course, there's bleeding. That's a relatively late sign, but it's still going to appear earlier on the left side than it is on the right side. So, of course, the colon cancer on the right side is more difficult to diagnose, so it has a worse prognosis.
Who is more likely to get right-sided colon cancer?
Well, women more than men, and Black Americans are more likely to get colon cancer on the right side than white men.
Does removal of benign tumors during a colonoscopy reduce the risk of colon cancer?
Well, yeah, that's a good question. If they're benign, no, but it is a diagnosis. But there are precancerous lesions called tubular adenomas, and they do increase the risk of having colon cancer. So it's if you have a colonoscopy and you get those things removed, you're doing yourself a favor.
Does smoking increase the risk of colon cancer?
Absolutely. And unfortunately, it increases the risk of right-sided colon cancer, which of course is harder to diagnose, more aggressive, and has a worse prognosis.
Does colon cancer rate as a cause of death in the United States? How does?
Yes, it does. It is the second most common cause of cancer deaths. It is the fifth most common cause of cancer. So what that tells you, Neil, is that This is a relatively aggressive cancer. There's a lot of people who get it and die from it.
Okay. Best place to go is worlddocallen.com and pick up Pregnancy Your Way, available today on Amazon. Thanks, Doc.